Good evening, viewers. Hope all of you are doing truly well as we have started managing well with the current pandemic situation. And today it is, of course, Wednesday for women, and I am back with Dr. Girija Wagh here. So, as we go forward with our session today, just a quick introduction about our platform, our online health channel, that is True Wealth Online Health Channel, which is an initiative of True Wealth Integrative Healthcare, which provides integrative and personalized health and nutrition advice to guide patients and healthy individuals to overcome their health concerns and manage self-health to reach the ultimate goal of holistic health and happiness. True Wealth aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. Rightly so. Of course, a quick note before that, True Wealth Live programs are organized for education and spreading more awareness to reach the ultimate goal of health and happiness. So please do not treat any of the experiences and the knowledge shared by the speaker or the participants to be as a personalized consultation. Every individual, we believe, is different and hence needs an integrated personalized advice to prevent or cure any ailments. You can feel free to reach us out on 98200 48369 or visit our website www.truewealth.in. You can feel free to ask us as many questions or express your concerns, and I'm sure we will try to do more than justice. However, we will not be providing any direct COVID related treatment advice on this program again. Right here have also put up a women's clinic, which is of course providing virtual as well as in-person advice as per the need when it comes to health, nutrition, and lifestyle. Treating several diseases right from PCOD, infertility, concerns in pregnancy, or obesity, thyroid, diabetes, dyslipidemia, nutrition, and lifestyle. And the idea is an open up program where women should come and talk freely, express their health concerns, and also derive solutions for it through medical health checkup and treatment advice from Dr. Girija Wagh and any sort of nutrition and lifestyle management advice that is particularly needed from me, Rajashree Gadgil. And also hand in glove goes the yoga and fitness advice, which we recommend through this holistic complete treatment advice that we give. Our speaker, of course, Dr. Girija Wagh, and it's always a pleasure to have this Wednesday for Women with her. She has about 3 decades of experience, especially in normal and high risk obstetrics and gynecology, IVF fertility treatment, diet control, PCOS, procedures of fertility promoting laparoscopic and hysteroscopic surgeries. She's, of course, MD, PS, and MD from in obstetrics and gynecology from the PJ Medical College and Sassoon General Hospital. She's diploma in advanced gynecological endoscopy from Germany. She has a fellowship of the Indian College of Obstetrics and Gynecology, and she's a fellow of Indian College of Surgeons as well. She practices as a consultant at Cloud9 Apollo Hospitals. She's also professor at the Bharti Hospital Pune and runs her own setup in Pune as well. She's been the chairman of the Medical Disorders Committee at POXI, which is a very coveted association, or rather an organization, which caters to and takes care of so many algorithms, neuro advances in gynecology. And Dr. Wagh is a staunch feminist and believes in empowering women through health, not just this generation of women, but that actually makes the upcoming next generation also gaining their advantage out of it. That is really her vision and perspective. Of course, I am Rajashree Gadgil. I have about 20 years of, again, global experience in nutrition formulations, continuing medical education. I have a master's in science from the Sion Hospital and an MBA in marketing as well. I have worked globally with coveted organizations, and my career encompasses through therapy areas like therapeutic nutrition, orthopedics, gynecology, gastroenterology, cardiodiabetes, pediatrics, and more. And as a nutrition expert, I'm also the founder of TRUWELLTH Integrative Healthcare Centers. That's in a nutshell about me. The last time we really spoke about pre-pregnancy planning, and today we are really on the path of conceiving and the first trimester, really on about which Dr. Girija Wagh is going to talk to us about. Welcome, Madam. Wednesday for Women and with you is always a great pleasure because it's such a learning experience. And I would definitely want to be very candidly expressing this, that doing these programs has been a huge learning for me as well. It has matured my practice of nutrition in women health greatly as well. So for whoever says that, these months of pandemic have been bad, I think it's in fact been more of learning and so much more richer and experience. So I think viewers are really waiting to know about the what you are really going to tell us about the first trimester. Last time you spoke so much in depth about how to prepare for a pregnancy. Now, what should they be doing when it comes to the first trimester?
Hi, Rajashree.
Yeah.
As always, I am very happy to be here on your show. And I don't know why my screen is not showing. Is it showing or no?
Yes, it is showing.
Okay, then I'll
It
just open
is.
up. Yeah, as I
Yeah.
told you that today we are going to discuss about the first trimester of pregnancy, and
Right.
most importantly, what we have decided and what is important according to me in whatever experience I've got through my practice of so many years, is the fact
Yes.
that there is a huge dearth of, and lack of awareness and
Yes.
know-how in women about in nutrition. And if this could
Yes.
have been easily available to them, I think there are a lot of maladies which we can just prevent. So let's look at, this is a screenshot of my, I'm sharing the screen of my own website wherein I have written this blog. And what is it trying to tell us is, this is the screen, I hope you can see what I'm showing here is the
Yes.
human
Yes.
development timeline. So you can see that the entire pregnancy of the 9 months, you can see my arrow by any chance? No?
Yes.
You can see the arrow also?
Yes.
So the human pregnancy, the 9 months of this human pregnancy are divided into 3 trimesters. And today we are going to focus on the first trimester of the pregnancy. And this first trimester of the pregnancy is that period which starts from the last menstrual period which the woman had till she becomes 12 weeks pregnant. And this is usually identified by the last menstrual period date that she gives us, or by a sonographic assurance. So that timeline, that period of 12 weeks is a very important period. And it is rightly named as an embryonic period because that is the time when you can see here that what actually pregnancy is. Pregnancy is a union of two cells. One is the sperm, and another is the egg, which comes from the woman, and the sperm, which fuse together. They form a zygote, and this then multiplies. This group of cells, which actually looks like a mulberry, it's like a mulberry with so many cells together. And this particular cell, when it goes and gets implanted inside the uterine cavity, it is actually like a mulberry. It's as cute looking as that. It's very, very small. And it starts implanting there and growing. And therefore, these group of cells, which are now multiplying into a 16 cell stage or 32 cell stage, and then eventually it undergoes a transformation to form the organs of the baby's body. So the first 12 weeks of this conception is the period during which the baby's organs are forming, and therefore this period is called as a period of organogenesis. Now, as the baby is forming on one side, on the other side, the placenta is forming. Now, what is a placenta? Placenta is a newly formed organ which forms in the uterus alongside the baby. There are certain parts of the zygote, the outer parts of the zygote, these cells, they differentiate into the formation of the placenta, and they get aligned to the cells of the mother's womb, and then they form sort of a conglomerate which is called as the placenta. And this placenta is actually cells which have gone and invaded the small little blood vessels in the mother's womb lining to form big sinusoids to help it expand so that it will be able to supply blood and nutrition to this baby as it is growing. Now, this phase of placentation also requires to develop, like when we plant a small little seed, there are going to be roots down, and there is going to be a shoot up which forms the plant. Now, this entire formation, the organogenesis and the placentation, these require very controlled environments which are replete with lot of good oxygen supply, which will come from good hemoglobin level. It requires a lot of proteins, which is going to change a lot of hormones in the woman's body and make changes in the woman's body. And these proteins are necessary because of the multiplication of the cells. And you require to have a whole lot of micronutrients like the folic acid and the folates and the biotin and so many other things, because new tissues are getting built up. Now, these are also necessary to maintain the correct hormonal support. You are seeing that women who have obesity, women who have hypothyroidism, women who have deficiencies of various micronutrients, or women who have any kind of other ailments, high hypothyroidism, for example, these women are much at a higher risk of developing miscarriages because these fall short. The babies do not grow optimally. And therefore, and this is the time when we require to definitely focus. If you remember, in our pre-pregnancy planning also, we spoke about these things, because when you become pregnant, the time, the day you miss your periods and you do your uterine pregnancy test, already the baby's neural tube is formed. Already the baby's neural tube is formed. And then after about 5 weeks or 6 weeks, the baby's rest of the organs start forming. So if you have caused any kind of deficiency, it has already affected the baby. And therefore, it is not a you talk of only that first trimester. Abhi मैं pregnant होने के बाद I changed my eating pattern and then I started eating folic acid and all, because doctors can do only that much. If you come to us when your pregnancy test comes positive, we will diligently write folic acid for you. But if you're already suffering from a deficiency, very little can be done because the foundation has already formed. And that is what we have to realize. In this first trimester, our responsibilities are that if you look at this point in time, you are seeing here that the last menstrual period, fertilization occurs on the 14th day of the any menstrual cycle. And when the patient misses her periods, when week 1 to 4 is called as the embryonic period, during which time also it is important. Sometimes women take medicines, headache medicines. Sometimes they take acidity medicines. Sometimes they take any kind of medicine. And if you have inadvertently taken these medicines at this time, they are going to cause problems to the baby. So what do you do in the first trimester? One, now that you are embarking on pregnancy, ensure that you are taking proper folic acid supplements, that your diet is proper. And I'm sure Rajashree, you are going to guide us about that. When I'm talking about these are my expectations from my patients that they have to be taking this, you are going to tell us from where are we going to take this and how we are going to source them. And secondly, what is very important at this point in time also is that You are not supposed to take any medications whatsoever which are not supposed to be safe. So don't take any medications. Once you have crossed over from 14 to 15 days from your last menstrual cycle, do not take any prescription medicines for any reason or any over the counter medicines. Please remember, because if you take anything, period postponement tablet, headache tablet, eye pill tablet, anything, and then you get pregnant and you have to decide, I'm going to continue this pregnancy, we are going to be in a big soup. So the smartness is that you have to definitely decide, okay, I am going to get pregnant, I'm getting married, I want to have babies. If I get pregnant, I'm going to continue them. Then be very, very careful that you have diet which is rich in folates, DHA, proteins, omega-3. All these are essential. Half of the time, women are busy vomiting. And I want to share this with you, Rajashree, that if you look at the incidence of pregnancy vomiting, if you look at the studies and the publication, it mentions that the pregnancy vomiting occurs in about 10 to 12% of patients. I will share with you my experience. In the current 3 years that I'm carefully observing, there is a definite rise in vomiting response to pregnancy. And if you look at the reason why vomiting occurs because there is a change in the hormonal level. HCG hormone, which is secreted by those special cells of the baby, it is rising and multiplying doubly every 48 to 72 hours till the time that the pregnancy is about 8 to 12 weeks. And therefore, scientifically, if you ask me, this pregnancy vomiting should be occurring, its peak has to be around 9 weeks. While what you will see in my practice, 5 weeks, either pregnancy test positive aya, either patient comes with two complaints. I am feeling nausea, I am feeling tired, I feel giddy, and I have a backache. Can you just relate to this? What is that small little 5 weeks pregnancy going to cause you problems? This is a reflection that one, you have very high levels of stress. Why should you have backache? You're responding adversely to your positive pregnancy test. Secondly, you may be having an underlying gastritis, which has been developed there because of your wrong dietary practices, which is now becoming overt. And little bit of rise in that HCG hormone is causing your problem. And therefore, if you come complaining about these, we will have to investigate to find out, are there any other reasons why you're vomiting? So one reason of vomiting is the rising hormones of your pregnancy, which are essential for the better growth of the pregnancy, and you have to dissociate and learn to live with it and find alternatives and strategies which we can help you. It also is a reflection of pyridoxine deficiency, which happens because of excessive consumption of coffee, excessive consumption of wrong kinds of foods, over the counter. Even with COVID, there was lockdown, and my heart every day used to pain to see women who are sitting on those thelas and eating vada pav and things like that in the COVID. Please cook food at your homes and eat healthy diet, because one of the other challenges which I have during the first trimester of pregnancy is getting infections such as jaundice, hepatitis, gastroenteritis. These are viral infections to begin with. They will turn into bacterial infections. And all kinds of infection are related to the bodily mechanisms of an inflammatory process. If you are always having gastritis, you are going to have a much susceptibility to develop any kind of these infections. And if you happen to land in hepatitis, that is liver infections, which are jaundice and all in pregnancy, unfortunately, we have to make a choice between the mother and the baby. We will have to give you medicines to save your life rather than considering what is going to happen to your baby. So let's not get into these kind of life-threatening practices. It is very important that the first trimester is the foundation of your pregnancy, and it has to be looked at very, very seriously. So as we recommend, I have mentioned here that deficiencies of folates are corrected by regular consumption of supplements yielding at least 400 micrograms of folic acid at least 100 days prior to conception. Formation of the neural tube is occurring simultaneously when the embryo is getting implanted, which corresponds to the expected date of menstruation. This is what I was explaining just now. And pregnancy is usually confirmed after a week of missing periods. By then, Your foundation of the neural tube is already laid as in the picture below that I showed. Now, what are these neural tube defects? And what are these teratogens that I was talking of? Some women are taking some medications, like they would be taking hypertension medicines, or they would be taking some anti-tubercular medicines, they would be taking anti-epilepsy medicines, or any such kind of psychiatric medicines, the antidepressants. All these can cause problems. And these medicines can give rise to deficiency of the folic acid. So even if you're consuming folic acid, it may not be effective, and therefore you can be predisposing to birth defects, even hyperglycemia. So if you have uncontrolled sugar, if your HbA1c is more than 5.7, you have possibilities of having abnormalities in your baby. If you consume alcohol, alcohol is a teratogen, and if you consume alcohol and then you realize that you're pregnant, already there is going to be a problem. If you have been exposed to X radiations, if you have exposed to heat, thoda sa pain ho gaya, immediately they will put that hot water bottle on the tummy. And that hyperthermia even induced because of fever. If you have fever, if you have temperature rise, that can also cause problems. And what has been found, I spoke about this last time, I'm speaking again. If women already have hypertension, blood pressure rise, just by the presence of their hypertension itself, they have a possibility of having babies with congenital heart disorders. Heart diseases can occur in these patients. So therefore, pre-pregnancy is optimization is important, and the same control in the first trimester is important. Taking medications, antibiotics over the counter can be problematic. And this can be brought about effectively if you understand. Now, what are these birth defects? Approximately 1 in 40 pregnancies can be affected by birth defects. And India has a dubious distinction of having the largest number of infants with birth defects and genetic disorders in the world, because majority of our pregnancies are unplanned, and NTDs are the birth defects that are of epidemic proportions, inviting the WHO focus in 2019 on birth defect prevention in Southeast Asia. And we are at the center of this entire pandemic, what we call of birth defects, having even serious consequences than the COVID that we are thinking of, because you are creating a future generation which can be defective, and which sometimes you wouldn't want to even have them. And unfortunately, they will be born or they will be terminated. And that is really, really very sad. Disorders such as Down syndrome, spina bifida, birth defects, anencephaly, where the baby's brain only doesn't develop, absence of kidneys, babies don't have limbs, they can have fistulas. All these kinds of birth defects can occur, and there are a few pictures that I have put in here. And this is the neural tube that I was talking to you about, Rajashree, that this neural tube forms when you are already missed your period on that same day. And this neural tube, this neural fold is the foundation of your entire nervous system, which includes the brain, the spinal cord, and all the nerves. And if there is a defect, you can see that this is a baby who has anencephaly. This is a baby who has an encephalocele. These babies have closed spina bifida, various kinds of nervous system disorders, which are only diagnosed when the baby goes in the second trimester. The foundation has already happened in the first trimester. There were deficiencies, there were abnormal insults such as viral infections, some teratogens consumed by the mother, and this has given rise to these problems. And these definitely are preventable. And that is the reason why we have to be careful about nutrition. Now, there is something more which I also want to discuss, and that is about the nausea vomiting of pregnancy. Now, why is there vomiting during pregnancy? I just now mentioned that one component is the rising hormonal levels in the body all the time. The second component is your underlying gastritis, and the third component is hypoglycemia. You are already becoming hypoglycemic because there is increased metabolism in your body, and therefore a lot of sugars are getting used for that metabolism. And then if you go hungry for periods of time, when I analyze the diet, Rajashree, I find that women would have dinner at around 9:30 in the night. Then they will wake up at 9 o'clock the next day morning. First thing in the morning that they will do is will take chai and khari or chai and toast or chai and biscuit. And then at around 12 or 1 o'clock, they will have some lunch. Are you seeing any protein? Are you seeing any folic acid? Are you seeing any folates? Are you seeing any omega-3 fatty acids? And then how are we expecting babies to grow well and this woman not have hypoglycemia and vomiting? Now, this hypoglycemia, then the other thing is the moment they become pregnant, the first thing that they do is drink coconut water first thing in the morning, which will cause more hypoglycemia, more vomiting. Or eat apple. I don't know why this apple has come in our lives. First thing they will do is eat an apple in the morning. The moment you eat apple, that acidity will cause acidic reflux and that hypoglycemia will further reduce your sugars. Apple is a fruit to be taken in the afternoon or the evening, not first thing in the morning. First thing in the morning after waking up, the first trimester woman has to first take something which will immediately increase the sugars. I usually recommend taking smoothies for them. Take
Yes.
smoothies which are having nuts, yogurt,
Yes.
fruits. First take that. First take your shot of protein and everything. And then start looking for breakfast food or anything in this world. Sometimes they will get up at 6 o'clock, but they will have their breakfast at 9 o'clock. मैं पूछती हूँ 3 hours, how can you live with so much of hypoglycemia? And then there is acid secretion, then there is nausea. And these things require a lot of attention because the common dictum during pregnancy is have small food portions and have them more frequently. Eat little, eat more so that it will get assimilated, it will get digested, you don't feel like throwing up, and you will exactly know what is doing well for me, what is not doing well for me. You can choose your combinations as per your needs with proper identification. And secondly, you should not sleep long hours where you'll get hypoglycemic and dehydrated and get into starvation mode. Because if you starve, if your sugars drop down, the metabolism is then taken over by muscle breakdown products, which are ketones, and these ketone bodies cause harm in placentation as well as organogenesis. And then how are the babies and the placenta going to form? Then you go into the second trimester. The doctor does sonography, says the doctor, the baby is growing borderline. Then you do sonography again after 24 at 24 weeks and then say, oh my goodness, there is growth restriction. Baby is not growing, the placenta is also not growing, woman gets blood pressure, woman gets problems. And then we say, doctor, but I was coming to you from 4 weeks. Why did this happen? Because you were not taking your diet properly. The doctor cannot go inside and hold that placenta and make it grow, right? It's only going to be your food. It's going to be your temperament. It's going to be your rest. You have to take rest to the tune of 9 hours per day. So you divide it as 6 to 7 hours and maybe 1.5 to 2 hours in the afternoon, or I have light cat naps on and off. You ensure that you are taking proper balanced diet, which is replete in everything that I've said, and you're not going into starvation mode. Do not take any medicines. These are the important mantras that we have to remember. And therefore, if the NVP, that is nausea vomiting of pregnancy, is excessive, many women require hospitalization, treatment, injectables, and they undergo a lot of frustration. They feel that the doctor is not giving them adequate treatments. They feel that there's something going wrong. And another very important question with this nausea vomiting of pregnancy is also an underlying psychological abnormality. Sometimes women do have a lot of stress. They really do not know now what to do with their pregnancy. There's nothing to get scared of pregnancy. This country has born 1 billion population. It came from the mother's womb. So all of us have been born from there. So what is there to get scared? It's your normal physiological function of your body, wherein you have to bear children, which is an important function. Bring up healthy children, that's your responsibility. Building the nation correctly is all our responsibility. And therefore, we have decided here, Rajashree, to be holding our steed this month, talking only about pregnancy nutrition through every aspects, because I feel that both of us, through whatever little access we have to the population, to the environment, we have to contribute by guiding them correctly and telling them rightly, because we have to contribute to making the future healthy society. Now, you and I cannot bear children, but at least children that are born by my women, my patients, have to be healthy. And that is my policy statement for life and my profession. That children, therefore you'll find that in my practice I'm very strict about diet. Sometimes some of my patients appreciate it, sometimes they're not very happy with what I'm telling them. Sometimes they don't want to listen, they say, I'm doing everything under the sky, doc, what are you telling? But then these are the reasons, my dear darlings, why I get behind your back all the time pushing you, please eat, because I want to ensure. And I always tell them, Rajashree, as long as these babies are inside you, they are my babies. So till that time, you have to take care of my babies. Once they are born, they are your babies. So lack of sleep, irregular eating schedule, junk food, excessive spicy food, starvation, strong smells such as tadka, motion as in getting into a lift or riding or driving can act as a trigger for this vomiting. And overeating can also cause vomiting. Generally, a working woman would want to stuff herself with food, not wanting to eat outside food, or the loving family wants her to eat to help the baby grow, etc., resulting in forced feeding. And this can cause problems. And you can deal with it. First, accept that queasiness is going to be there. Self audit your diet and identify whether you are taking proper food, and identify that foods suit you best. Identify your triggers and deal with them, and avoid typical cooking, which is the cause of trigger. So, for example, if you are not liking dal and rice, then you make khichdi and eat. If you don't want to eat chapati bhaji, you can make varan for or something, na? Something like dumplings. You can have that, or you can make a paratha and have. So you have to make your alternatives. What suits you best? That's you're going to eat. Try to be content. Be happy. Be grateful. You are pregnant. It's a wonderful blessing which has come to you from the universe, and you have a lot of things. uh, You know, uh, it's such a wonderful blessing. Nothing in this world can be compared to the fact that you're bearing a baby. Happy, be rested, because whatever you do now, it's going to reflect in the growth of your baby, the growth of the placenta. And therefore we have to be very, very positive. Do not starve and overeat. Take light bland meals and easy to cook foods. Like normally I tell them, make khichdi curry, and then with that you may have some, some sort of a aloo vadi or some sort of a such thing, or make just for the like you make a uh, green leafy vegetable. Along with that, you may take rice or
Curry,
quinoa,
yes.
something like that. So you don't have to go inventing things, or make a chicken soup and have it with rice. So that you have proteins, you have carbs, you have everything inside it, and take it with a fruit or a salad. So this is how you have to plan your diets, and you have to ensure that you don't tire yourself making too many things. So be well planned, be well prepared, stuff your fridges with appropriate things, make a plan. Most of our women are working women. They're making such wonderful plans for their offices. They're making such wonderful plans for so many things in their life. Even eating food requires a good plan. And if you have a wonderful plan, you are going to click it and do it well. So warm water with honey. This is my diet, Rajashree. This is standing here for your criticism and correction if you want to. So this is what I usually tell my patients: warm water with honey and shredded fresh ginger first thing in the morning. That keeps your nausea at bay. Take 4 almonds and chew them, and add 2 or 3 nachni or wholemeal biscuits, or even protein threaptin biscuits can be taken.
Right.
After a while, take some amla juice if you have too much of NVP. Take small bowl of semolina or oats porridge with fruits, nuts, and room temperature milk. You can add a boiled egg here. Mid morning, have a light tea with khakra or besan laddu with some cold flavored milk. You can also have plain dal for lunch with roti and ghee with some raita. Evening snack can be a dhokla or an upma. I also tell them you can have moong sprout or moong chila. Fruit plate per vegetable smoothie, moong dal khichdi with kokum based sour or curry. Always
Yes.
carry some chocolates, fruits, nuts, and dry snacks with you. Patients come to the hospital, wait long hours for their sonography, for their checkup at their turn, and there's nothing in their bags. You must carry your dabba with you, some milk, some cold milk, some smoothie, some water, so that you don't get dehydrated. Drink water sip by sip. Do not suddenly drink a lot of water. Brush with a soft bristle brush and be gentle with your tongue, cleaning, as it can trigger nausea, vomiting of pregnancy. And there are certain foods such as ginger, amla, and kokum, aloe vera, which are known to have great help due to their contents of specific ingredients which can help. And then, of course, the rest of the things I have already talked to you. I have given some example here. If you're interested to read more, you can visit my blog here. That is at drgirijawagh.com. Type NVP and you'll get to know about it. I think that ends my contribution towards today's session. Rajashree, you can
Yes.
take over from here. And if you want me for anything, you can just tell me. I'm here only. I've just put
Yes.
my audio off. Okay. Thank you.
Sure. Sure. So that was really extensive input when it comes to understanding the first trimester, all the intricacies, and also, how important eating is, how much important nutrition is. Madam has really spoken in so much in depth today that, I am also going to add my inputs to all really that she has added, and you will realize that I guess most of these aspects are so much aligning, the thoughts are so much aligning, and that's what really happens every time. And so I keep talking about, and I keep reminding you about, it is always balance, 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 and balance. And the balance has to come from the stage of planning, really. We spoke about this the last time. So we have to have the balance. The plate has to be balanced, as I keep talking every time, but we all realize it. But like Madam said, that even through COVID, we are seeing people eating outside and not eating balanced foods, also bearing the risk of infections. So keep the balance, and the balance is not only these aspects, but I'm going to talk about the alkaline and the acidic foods also as we progress. But the first and foremost important balance of food is proteins, which we Indians are really not in eating enough. So make sure that while we are planning and through the entire pregnancy and the first trimester, make sure that you're eating enough amount of proteins. Most households, we see people eating laddus and trying to eat heavy foods so that you get better nutrition. But what we really miss is those proteins. Make sure that we eating proteins. Feel free to eat as much dairy as you can, because that's a good source of protein, also a good source of calcium. So it is very essential that we eat good amount of dairy, milk, yogurts. Yogurts is another thing which is extremely good, because it can keep you away from nausea, can help you aid in your digestion. So it's very important to consume that. Be wary of aged cheeses, etc., because that is something which you want to avoid. But not non-aged cheese is another very good source. Make sure we're eating good amount of eggs. We can eat paneer as an extremely good choice as well. Eat good amount of nuts and beans, because we need to have protein coming from the plant sources as well. Soya is another very good source. So like I said, up the amount of protein that you're eating to about 40-50%, and we Indians are really lower at around 20-25%. So go beef it up, increase it, control your carbs. Don't eat too much of carbs again, but you also need carbs to keep getting good energy. But also eating good fat is extremely important. So for the bone, muscle, energy, immunity, all that we need is really the right proteins, not just the quantity, but also make sure we're eating varied amount of proteins. Also extremely important to supplement yourself, I feel, during pregnancy, because just as Madam mentioned, that no matter how much you're eating, what we realize in the second and third trimester is that your growth of your baby is getting hampered. In the initial stages, it's extremely important when the embryo is growing that you need to eat the right proteins, and the amino acids that you get out of these proteins are extremely, extremely critical. Getting the BCAAs, that is the isoleucine, leucine, valine, and most essentially important are the glutamine and arginine, because they are really very important for the cellular growth, for any sort of infections to stay out. Arginine actually helps keeping circulation right. A lot of women experience, that the water reduces, the also women get hypertension during pregnancy. For all this, arginine is really, really important. It keeps your circulation well, and they are critically important when it comes to all this. And when we've been talking about our PCOS, we've been talking about these proteins. So it is extremely important. Proteins breaking down into amino acids for energy, muscle, baby's growth, and because they're very important for hormones, antibodies, that are required to fight infections, hormones which are extremely, again, important to be balanced throughout our pregnancy. And they're also important for enzymes, because Madam constantly spoke about the acidity issues, the improper digestion issues. What happens is we may eat as much right foods, but if they're not getting digested well, proteins are essential for actually formation of enzymes. Now, what do enzymes really do? Is the enzymes actually break down all that we are eating. Sometimes some people, yeah, if you're consuming too much of protein, suddenly start eating much of protein, are not able to digest it, and there, that is where you can start getting acidity, nausea. For all those kind of conditions, getting a enzyme supplementation, again, I feel, is extremely important. So what you, or because no matter how much foods, these are the foods also, recommendations of foods which contain good amount of enzymes, but they're not sufficient enough to be able to digest the excess good diet that we're eating. So while we're eating pineapples, apples, bananas, coconuts, grapes, papayas, which have good enzymes, it is important to get a good supplementation so that whatever you're eating gets digested and assimilated well. In Marathi, we say angi lagat nahi. So angi lagana is extremely important for the mother, and because that is what is going to go to the baby. So remember, keep these facts right. Also, we have to make sure that, if you have not been eating right diets, essentially vitamin mineral deficiencies all throughout have to be corrected, not just the specific minerals and vitamins which I'm going to talk about, but a complete combination of vitamins is important, because they have a synergistic effect. They are very important as antioxidants. They're very important for uptake of nutrients again. So make sure that we are eating all of these essentially well. Then I was talking about the balance. When it comes to balance, and balance of alkaline and acidic foods is also very important. If you're eating too much of acidic foods, again, what happens is the food won't get digested well. If you're not eating enough acids again, or enough acid production doesn't happen, then what happens is, again, your food is not going to get digested. So we need to have a proper balance of alkaline and acidic foods. If we keep acidic foods under control, eat neutral foods, acidic and alkaline foods, which I've put examples out here saying acidic foods are more of poultry, fish, dairy, eggs, alcohol, which you should not consume at all. Also, along with it, neutral foods like natural fats, starches, sugars, and alkaline foods, which contain fruits, nuts, legumes, and vegetables, which are extremely important to be consumed, because these are the ones which are going to keep the nausea and the vomiting under control. A lot of women are not able to eat well, and which causes issues in the for your baby, and in the early stages, it is extremely important. We may realize it later when the baby's weight is not gaining as much, but whatever your doctor is trying to tell you, the growth in terms of genetic growth has to happen, and she will tell you rightly that you have to get a diet, and it is extremely important to get a diet advice, a planned diet advice, which you should follow. Madam did explain, what can be eaten in the day, but you need to have that kind of a protocol day in, day out throughout your pregnancy, and that really helps hugely. So we keep talking about eating fruits, and because they can be a good source of antioxidants, where again she mentioned about inflammation. That is another thing which I importantly talk about, and I will address that at the end of the presentation, that inflammation has to be kept lower. The oxidation that is happening due to toxins, the toxic gases that we breathe, the so much of pollution that is around the right foods. If you're the sources of foods give rise to a lot of toxins in our body. These have to be kept out, and antioxidants in the form of good fruits, right from bananas to pears to grapes, pomegranates, are extremely important. There are specific fruits and vegetables though which should not be eaten, and which is the reason why you need to get a right advice. Why do we need to eat so many of these vegetables and fruits? Is to understand that we have a need of folate and folic acid. talk about. Folate is really a B vitamin that helps prevent neural tube defects, serious abnormalities of the brain and spinal cord. These are extremely important, and these three aspects, that neural tube effects, serious abnormalities, and brain and spinal cord abnormalities, have to be kept out, for which eating right nutrition also in the first trimester is extremely important. The synthetic form of folate found in supplements is and fortified food is called folic acid. The good food sources are green leafy vegetables, citrus fruits, dried beans, and peas, and which is the reason why we should be eating so many of these vegetables and fruits. 400 to 1000 micrograms is the requirement before conception and throughout the pregnancy, and folic acid supplementation has shown to decrease the risk of premature birth. So yes, again, supplementation is important, though these are the varied kind of foods, including cauliflower, broccoli, asparagus, green leafy vegetables, bindi, which we eat, mushroom, avocados, beetroots, papayas, oranges. These are the foods, seeds, nuts, beans, lentils, which we eat, comprise of folate. And there are different strengths of the amount of folate that we can get. Like from spinach we can get 130 mcgs of it, or from oranges you can get 29 mcg. So these are the different variants, and you should let this leave it to the experts to tell you how much needs to be consumed of what. And again, calcium is very, very important because it's important for the strong bones, teeth, cellular growth of your baby. It is also extremely important for normal functioning of circulatory, muscular, and nervous systems in your own body, because it's important for both the baby and you. 1000 to 1300 milligrams a day is required. There are good food sources, like I said, dairy, fish, fruit, vegetables. These are the different sources. So that is why I said drinking good amount of milk, dairy. I did show paneer and milk and cheese yogurts to you. Other ones are also soy milk, rice milk, tofu, the chia seeds, spinach, almond butter. These are other choices also. So in case you're not able to tolerate milk, also there are a lot of these options that we have. Sesame seeds, we have orange juice. We can eat a lot of good nuts, and again, these also contain good omega 3s, which we will talk about. And iron again is exceptionally important because body uses iron to make hemoglobin, which is a protein in the red blood cells that carries oxygen to your tissues. During pregnancy, you need to double the amount of iron that non-pregnant women need. Your body needs this iron to make more blood supply oxygen to your baby. If you don't eat enough iron stores or get enough iron during a pregnancy, you could feel the fatigue, you could develop iron deficiency anemia, and severe iron deficiency anemia during pregnancy also increases your risk of premature birth, having a low birth weight, and postpartum depression. This is a very big issue in Indians. 27 milligrams a day is essential. Good foods could be chicken, fish, iron, fortified breakfast cereals. So here again, I've put on a nice visual here for you to see, chicken, liver, beef. That is non-vegetarian stuff, but vegetarian stuff could be dried beans, broccoli, potatoes, spinach. All of this needs to be eaten in a good balance. Raisins, again, peaches, watermelons have to be eaten. So that's really when it comes to iron. And then the next really is the omega 3s, which I highly recommend anytime everyone should be having, but especially during pregnancy, it is extremely important that good amount of, say, about 200 milligrams of DHA during pregnancy is needed, but a good dose of about 1 gram of EPA DHA can be taken as a supplement. Highly recommended because it keeps the inflammation down, it keeps the antioxidant effect going, keeps the depression away, and is of course going to help your baby's growth. So good fats are equally important as are the proteins when it comes to your health of you and your babies. When it comes to carbohydrates, we have to still make sure that our BMI is under control, and which is the reason why we should be eating complex carbohydrates, eat whole grains, millets, oats, nuts. These are extremely good to be consumed. Fruits, including apples, berries, melons, oranges, are very good again. Legumes to be included, and these can be good carbohydrates. Keep eating complex carbohydrates is extremely important. With it, eating fiber again is a component of carbohydrate, but eating good fiber and optimizing the intake and watching that you're not eating too much of fiber is again important, because too much fiber can again cause you bloating, discomfort through your pregnancy. So around 25 grams is the requirement, but you have to again balance it as your pregnancy progresses. So make sure that you are eating the right fibers. There are different types of soluble and insoluble fibers again. Good fibers can also help keep the good bacteria in your intestine well, and then can actually even take care of infections that could be caused in your body. So, keeping infection away is absolutely important. So eating the right foods, balancing it with good fiber, and like we said, keeping the oxidative stress away, because this is the most important reason why why you could have miscarriages, you could have defects, and to have a healthy pregnancy, it is important to keep oxidative stress and chronic inflammation away. And for that, you have to understand that inflammation, what happens to an apple when it is exposed to oxidation. That is how your cells get exposed to oxidation when toxic substances enter your body. So to keep this away, and what happens is inflammation causes oxidative stress. Oxidative stress in turn again causes inflammation. It is a bad cycle which you have to break during pregnancy. And it's a good idea to consume a nice drink. Just a nariyal pani may not be enough, and in the mornings, especially when you're experiencing nausea, if you could take a good mix of vitamin, minerals, and electrolytes, which is extremely important. If you're able to consume that with good antioxidants and herbs in the morning, herbs which are safe, and then that can actually really start your morning well. This could be a very good option to get your first bout of minerals, vitamins, minerals, electrolytes in the morning. Keep the anti-inflammatory, antioxidant effect going in the first shot in the morning itself. Keep your nauseas away, and that way you get a good start to your day and you feel energetic to be a mom. The other options which you could of course explore, which even madam mentioned, you could have different types of smoothies. It's a very good idea. Make them with a mix. Having it with yogurts is actually a brilliant idea to start a day. You can toss in vegetables, you can toss in fruits to make those as she recommended. Also, you can start your day with salty crackers, ginger, peppermint teas, chamomile teas. These can actually keep the nausea away. Lemons are a very good option always. Lemon with salt, and you can just lick it up, and it can keep you away from your nausea. But what importantly she mentioned is the previous night, eating good amount, keep eating smaller portions is extremely important, so that it gets digested well. And make sure till you sleep, at least an hour before you sleep, you've consumed something which is easy to digest, and gives you good support in the night itself. So when you wake up, your stomach is not completely stayed empty for too long. That can actually increase the acidity, and then give you more nausea. So eating well and starting your day well with like I recommend going with a good drink of vitamin, minerals, electrolytes to start off with antioxidants is a brilliant start to your day, followed by eating in smaller portions, so you can keep the nausea away. It's very easy to keep the nausea away. If you do not crack it at the point in the beginning, then it stays with you, and nausea only keeps growing because of the nausea feeling that you have. So it keeps aggravating instead of reducing. You also have to remember that these are the foods to be avoided: raw meats, so raw eggs, raw meats, dairy foods. Again, you have to make sure that you should not be eating eight cheeses, but otherwise dairy is extremely important component of eating. Raw fish you should keep away from canned foods and papayas, and high sugar, raw sugar, which we call, keep away from them. Keep away from caffeine, alcohol, and aloe veras and green teas. Do not consume too much of green teas. Really, that is what is needed. And of course, keeping a good fitness regimen. Make sure that you feel energetic, happy, doing a routine of fitness, which is important. And at the end, of course, having good sleep, good quality sleep is extremely important, which a lot of women are deprived of. So really, a good nutrition, exercise, and sleep is very, very critical. And that's with that, really, we wish you the best through your pregnancy, is what I would like to say. And madam, I think if you these were my inputs. I think going over this session itself was such a happy and brilliant feeling. Like you said, that we cannot be making more babies, but giving these inputs to for our patients to be able to have a great next generation is extremely important. Would you want to put in some points so that we could actually close today's session,
Yeah.
which already was so beautiful?
Yeah, Rajashree, that was a wonderful collection of the slides. As always, we never discuss these topics beforehand, but somehow come to align. And I feel that I like to keep it that way, because then that also gives me an insight, and we are not sort of biased by each other's opinion.
Yes, yes,
And that is very important, because your source of information comes from a different source, mine comes from a different source,
yes,
and therefore it's extremely important that we are in alignment, despite, and therefore everything is common. So finally, everything boils down to taking proper nutrition, is what we have concluded. And we
yes.
have to ensure that we are keeping our women's health guarded, especially through the first trimester, because it's a question of future generations that we are going to come up with.
Absolutely. So, yeah, we have already gotten some good comments for today's lecture. That very, very good inputs. We're getting likes on our channel as well for this. So, yeah, it was a great session with you as usual. It's really beautiful to be on this Wednesday for women. And hopefully we'll be able to make it the next week. Otherwise, it's going to be a big Diwali week here tomorrow.
We require a vacation for about a week.
Yes, yes. But we would probably try to replay one of our shows for the women to be able to see one of the ones which was with good inputs. And we will definitely be back 2 weeks down with all of you. And we wish all of you a very happy Diwali. And I think, madam, I'm on the channel every day, but you would want to probably wish the viewers and the viewers,
Yes.
thank you for
Happy Diwali, a healthy Diwali. Be safe. Don't go shopping, please. You're going to cause more COVID. And try to wear your own clothes which are there in the house, and enjoy a healthy Diwali. Make resolutions for a healthy future and a healthy pregnancy.
Sure.
You
So
all the best.
on that note, we will see you again, viewers. Thanks for supporting. We have some very brilliant sessions coming up this week, and in the end of the, we will be ending the week with a session on diabetes, because it's going to be diabetes week next week, and it is with four stalwarts from Mumbai. So we would not want you to miss the diabetes session, which will be coming up. So thank you, ma'am, again. We will end the show with a promo of RSG Energy and Nutrition, who has always been supporting us through all the technical support, taking this session to different groups, reaching it to many different platforms and people, so that you all could gain the right, authentic information that is needed throughout when it comes to women health.